Good morning. Today we're going to be talking about kidney cancer, a hidden threat. And that's because the World Kidney Cancer Day is coming up shortly. Thank you, Dr. Habeebu and Dr. Iwuji, for coming on the program. It's a pleasure to have you with us.
Thank you.
Thank you.
So if I can, let me kick off with you, Dr. Habeebu. Can I ask you to talk about kidney cancer? What exactly is kidney cancer? And why is it often referred to as a hidden threat?
Kidney cancer is a cancer that develops from the kidney. It's a hidden threat because it is very insidious in presentation. Most of the time, it presents late because it doesn't come with obvious symptoms. There are three classical symptoms that we can use to suggest kidney cancer. That is flank pain, a mass in the flank, and hematuria. Unfortunately, about 10% of kidney cancer, only 10% will present with these classical symptoms. So most of the time it is missed and it gets advanced before it's diagnosed. And when it's advanced, because of the resistance to chemotherapy, resistance to radiotherapy, it becomes a bit more complex to treat. There are newer agents that can really be used to treat kidney cancer, agents that interfere with proliferation by interfering with formation of vessels. That's angiogenetic agents.
Yes, but we'll get to that. I think first we just want to understand a bit more about kidney cancer. I've been told it's on the rise globally.
Yes, it
Is
is
that
on the
true?
globally. Yes, it is on the rise globally. It is on the rise globally, and we have both familiar factors that causes it and acquired factors. The familiar factors, there's genetic predisposition in some families that has chromosome 3 abnormality. And we also see it more in patients that smoke. Smoking has been attributed to be the most significant factors that predispose to renal cell cancer, and obesity also predisposed to it, and exposure to certain chemicals, aromatic hydrocarbons, they also predispose to it. Uh, Apart from that, uh, more of genetic, even though cigarette is the primary factor that causes uh, renal cell cancer.
Okay, so can you tell us though, what are the most common types of kidney cancer and who is most at risk?
Yeah, we have the sarcomatoid kidney cancer, we have the clear cell type, and we also have other type. Largely, most of them will develop from the proximal end of the nephron. This where most of the time the primary renal cell cancer develop from.
Okay, so who is most at risk and what are the other types? That's the most common type. And who is at risk of that? Is it the smokers, as you mentioned?
The smokers, the obese, these are most likely to have kidney cancer, and those whose family who have higher incidence in the family, that's those who are genetically predisposed, they are also likely to have kidney cancer. People who are occupationally exposed to some type of hydrocarbons, aromatic hydrocarbons with benzene ring are also predisposed to having kidney cancer. It is said that in the US, blacks, that's African origin, increase the predisposition. Also, white has the least predisposed, whites in America are least predisposed. So blacks and other minority have higher incidence, black topping the incidence. These are the statistics that are available.
And just to add to that as well, Dr. Habiba, as you were saying, they're the in terms of the lifestyle factors, things like the smoking and obesity, but also for some patients who might have particular healthcare conditions. So patients who have renal failure. So if they've had chronic renal failure or chronic renal stones as well, that can sometimes, not always, but sometimes predispose them to developing kidney cancer as well. So that's another potential risk factor. And also kidney cancer tends to occur in older patients. So patients who are over the age of 75, that's more common. But sometimes in our environment, we end up seeing patients who are a lot younger developing kidney cancer.
Dialysis, long-term dialysis has also been said to predispose to kidney cancer. Those who have kidney transplants also are said to be predisposed to kidney cancer. And there is a cystic disease of the kidney. Those who have that too are also predisposed to kidney cancer.
Now, you've told us that there are a few early warning signs. You mentioned them, but that only 10% of people will have these. So we're now talking to the general public, and they want to know how they can pick it up. Are there routine screenings? I mean, how is a person who is aware, who listens to this kind of program, to have an advantage in understanding and knowing when to reach out for help and when they should suspect something like this is going on?
Regular urinalysis can help, can pick occult blood from the urine. That is one way that we can pick it up. Imaging when we have other conditions like ultrasound scan may help to pick up kidney lesions. In this part of the world, there is no routine screening already targeted for renal cell because of the fact that the percentage of people that have renal cell is not that high in this part of the world.
Wow. So what else can they do? Dr. Iwuji, any thoughts for people who are listening? Because we've talked about this hidden threat, and it's for a lot of people, they're saying, this thing still remains hidden.
And that's the unfortunate thing. So whenever we're looking for potential screening tests, what we want is a test that will be able to pick up the cancer at a relatively low cost and be very sensitive to that illness. And the unfortunate thing with kidney cancer is that's why it's called the hidden threat. Not just in Nigeria, but anywhere in the world, there are actually no screening guidelines for kidney cancer. But what you can do is if you know that you have a first degree relative, so like a mother, a sister, a brother who has kidney cancer, then you can go to your GP and they can screen you, like Dr. Habeebu was saying, a bit more regularly by checking your urine sample and maybe doing some screening scans. But it's not something that the average member of the public can just go out and start seeing their GP or their general practitioner or their doctor for tests. If, however, you do notice, like the advantage of being on this radio show is that if you notice that you have got blood in your urine and it's persistent and you've got pain sort of in the area between your ribs and your hip and sometimes extending to the back, that's another thing. If those symptoms, that pain and the blood in the urine is persisting, then that could be a warning sign, especially if it's associated with things like weight loss, you're feeling more tired than usual, and those sort of symptoms of decreased appetite as well. If you notice all of those things coming together, then that could be a potential warning that you need to see a doctor and get yourself checked out.
Yeah, I think, to be honest, blood anywhere that it shouldn't be. It should just be flowing in your veins. Anywhere it's coming out of,
Exactly.
and it's just happening. Please, everyone should, take that very, very seriously. And so, no, I mean, I like what you've said. And I think that we need to pay more attention. And especially if you're a smoker. I mean, unfortunately, smokers don't tend to be very sort of health conscious. Maybe a person who's become more health conscious has stopped smoking needs to, really listen into this, or their spouse really needs to key into this and say, you know what, I need to make sure that this is being checked out for. Now, does high blood pressure play any role? You've talked about smoking and obesity. Is there any role for high blood pressure at all?
Yes, high blood pressure can be linked to increase in risk of renal cancer. Unfortunately, renal cancer too, if untreated, may result in renal disease, that's renal failure, that also will result in high blood pressure. And pain, usually we have, especially artisans, they are used to abusing analgesics. Unfortunately, prolonged use of NSAIDs can also increase the risk. And phenacetin drug containing phenacetin to prolonged use can also predispose to renal cell cancer. And most of our artisans, they abuse these drugs. They take painkiller daily.
What about occupational or
Oh,
environmental exposure to
yes.
anything? Are there certain occupations that need to be more sensitive or more aware?
If you are working with chemicals, whatever type of chemicals that has aromatic hydrocarbons, be it you are a vulcanizer or a panel beater, or you are working in the laboratory and you have exposure to aromatic hydrocarbons, it will also predispose to kidney cancer. So occupational hazard is also being linked to kidney cancer.
Thank you. Thank you very much. So, Dr. Iwuji, can you talk to us now about diagnosis? How is the diagnosis made? And from your perspective, as an oncologist, a medical oncologist, what are treatment options that are available?
Okay, so in terms of diagnosis, a lot of the time, as has been mentioned before, kidney cancers are found by accident. So people are probably getting a scan for something completely different. And incidentally, they find that the person has a mass on the kidney. But generally, the main forms of diagnosis would be getting some form of a scan, an ultrasound scan or a CT scan, then getting a biopsy so you can get a tissue sample to prove that this is actually a kidney cancer, and looking at that under the microscope to make the diagnosis, and that will then help you go on to your treatment. It's also useful to do just the normal baseline blood test to see how is the kidney cancer affecting the body. Like, is your full blood count normal? Is your kidney function normal? Is it affecting your liver function as well? So those are the three main things: the blood test, the imaging, and the biopsy as well.
Well, now, if we look at, we've talked now about making that diagnosis. We won't talk now about treatment. Dr. Habeebu mentioned that treatment isn't that effective, but are there newer treatments that are out now that could be?
Yes, thankfully. So kidney cancer used to be one of those quote unquote heart sink diseases because it does not respond very well to chemotherapy, does not respond generally very well to radiotherapy. But thankfully, in recent times, there have been some breakthroughs. Now, if you catch kidney cancer at an early stage, I do want to emphasize this, that if you catch kidney cancer at an early enough stage 1, before it started spreading to other parts of the body, for example, you have a survival chance of 90%. So the chance of you being alive in 5 years' time is 90% if you catch the kidney cancer early enough. And even if you catch it at stage 2 or stage 3, your chance of being alive in 5 years' time is still 75%. So if you can do things like the surgery to get rid of the kidney cancer, you can actually have a very, very good overall prognosis. But for those patients who have stage 4 disease, so by the time the cancer has been diagnosed, it spreads to other parts of the body. That's where we used to struggle as to how we should treat this kidney cancer. More recently, we've developed drugs like immunotherapy and what we call targeted therapies. Now, the way these particular drugs work is that with immunotherapy, for example, it helps the body's natural immune system find the cancer cells and attack those cancer cells. Because we know that when we have any kind of an infection, a cough or a cold or bacteria, our body helps fight that particular infection. But why doesn't it do it with cancer? Well, it's because cancer finds a way of disguising itself. So with immunotherapy, what happens is that these immunotherapy drugs help the body enhance its immune system so it can find the cancer and kill off the cancer cells. And it has really, really revolutionized the treatment of renal cell carcinoma. And in addition to that, we have these other drugs called targeted therapies, or tyrosine kinase inhibitors, to use the technical term. And what these drugs do is they're particular proteins that trigger the growth of the cancer cells. So when you give patients these drugs, it blocks those proteins, and therefore it prevents the triggering of the cells dividing. So you can actually combine the two drugs and attack the cancer from two angles. On the one hand, the body's immune system is fighting the cancer. And on the other hand, these targeted therapies are blocking the pathway that can cause the cancer cells to grow. And because we're able to combine these drugs now, we actually get very good responses. And the side effect profile is generally much easier to tolerate than what we used to see with things like chemotherapy.
Fantastic. So, Dr. Habeebu and Dr. Iwuji, I'm really happy to hear this. And I think this is so encouraging. The reality is now cancer is becoming much more treatable. It's also preventable in some cases. And so there's a lot more hope, I would say, in the medical world But there is still, though, that stigma, and people still hide it, and people still don't go for treatment or for to pick it up or to do anything. Even sometimes when a diagnosis is made, they disappear. So I don't know. How do we deal with this? How do we get people, we're talking about it now, to understand that there's just so much more. You can choose life rather than hiding.
Absolutely. I think we should even go back to where you started in terms of the stigma of cancer. We do need to talk about it more because what we find is that when people have had a positive outcome to their treatments, because of the stigma, they don't talk about it. But when people have had a negative outcome and God forbid someone has passed away, it gets blown up all over social media. So it's very important, and I know it's not easy, but for those people who have had positive outcomes from their cancer, it's very important that people speak out about this more. So that's the first thing, so that we can educate people and so that the population knows that cancer does not have to be a death sentence. Secondly, with kidney cancer, even though we're saying there's no screening, prevention is always better than cure. And we've heard today about some of the lifestyle changes that can really reduce the risk of developing kidney cancer. We know that smoking is a big factor, a lifestyle factor that can cause kidney cancer, but obesity, being overweight, causes 25% of kidney cancers. So by improving our diet, increasing our exercise, reducing weight, we can significantly reduce the risk of kidney cancer, and prevention is always better than cure. So these are the sort of messages we need to make sure people are aware of. And then, of course, if you do get the symptoms, go and see a doctor as soon as possible so that they can try and catch the kidney cancer at an early enough stage that you can have these positive outcomes that we're talking about.
Thank you. Dr. Habeebu, we haven't spoken about radiotherapy, which is your special area. Can you bring it in? Because how do you decide between surgery, immunotherapy, targeted therapy, radiotherapy for a patient? What are the distinctions? What's the process?
Yes, radiotherapy is still very valuable in the treatment of kidney cancer. Most of the time, or most of the cases, our patient present rather late. So even after surgery, we still need radiotherapy to irradiate the bed of the surgery, that's the surgical bed, or to irradiate wherever it has spread to. Usually, it also goes to the bones. We could irradiate the area. At times, it's inoperable, and we have to do irradiation to make it operable. That's with downstages that reduce the size, make it shrink, even though it takes a longer time for radiotherapy to shrink the renal cell tumor, but we still does over time. After treatment, over time, it keeps shrinking following radiotherapy. Radiotherapy for kidney cancer is a slow process. What it does is it stops the proliferation, and then there is a gradual death of the cell, as opposed to the usual treatment where it kills the cancer cells immediately. So that's the difference. The response to radiotherapy is delayed in this cancer, as opposed to the usual treatment that is very responsive. So radio is still very important.
So how do you decide when a patient comes in, whether you're doing radio surgery, immunotherapy, targeted therapy, radiotherapy? How do you decide when the person walks through the door?
We have guidelines. One of the guidelines is NCCN guidelines. And these guidelines uses the combination of how far it has spread, what we call stage, or how big it is, whether it has gotten to the vessel, the primary vessels of that, the renal vessel, the great vessels, or it has not. Then also whether it's high grade or low grade to determine. Most of the time, when it is operable, that's when it has not spread to involve the vessel or to involve the surrounding structure. We can do surgery right away. Then we do systemic therapy. Those are the targeted therapy that she has mentioned. However, if it has broken the capsule, that's the surrounding capsule, and we most probably believe that even if we do surgery, there will be some left behind, or even when it's not operable, then radiotherapy will be part of the treatment. And when it has spread to other organs, for example, supporting bone, and it's causing bone pain, will need radiotherapy. Also, some will present with hematuria. Hematuria is flank blood in urine. We need to then give what we call hemostatic dose. That's radiotherapy that stops bleeding. We need to irradiate, the tumor to stop bleeding. Radiotherapy is also very important here. And following treatment, if you see a residual tumor in future, you may have to just do radiotherapy, because usually surgeons don't like to go back to an area that has been, resected because of the fibrosis and the difficulty in identifying the anatomy, the distortion in anatomy. So because you can just do salvage radiotherapy that will re-irradiate the tumor bed. So radiotherapy is still very important for treatment of kidney disease.
Okay, clearly. So what, I don't know. So if I can just go back to Dr. Iwuji, what does survivorship look like after a kidney cancer diagnosis?
And that's a good question. So the survivorship does vary on a lot of things. It depends on the stage at which the cancer was diagnosed. Like I said, if we catch the cancer at a very early stage, then we can have a 90% 5-year survival. But if we catch it at a very late stage, if it's already spread to other parts of the body, then the chances of the person being alive in 5 years drops to closer to about 15%. But if you look across the range of kidney cancers, then in general, if you track the patients at about a year, 80% of patients will still be, alive at a year's
If I can, because unfortunately we don't have that much time. But what I really wanted to get at was how important is mental health support during and after treatment. I think that's what I was talking about in terms of the support for survivors.
Oh, I see. So no, it's very important for patients to have support. In terms of having support groups around them, so other survivors who have gone through the journey, who have actually conquered the cancer, it's important for patients who are going through treatments to meet these people so that they get the support that they need, and also from their family members, their friends, their other members of their religious groups, whether it's their church or their mosque, so that they know that they're not alone. And because it's a very difficult journey, cancer care, and it's important for them to know they're not stigmatized. So having psychological support is essential.
Thank you. Now, unfortunately, we have no time left. If I can ask you for your last words for our listeners.
My last word is that kidney cancer is curable when caught early. And just doing urinalysis can help. Urinalysis is one of the cheapest. Also, we need robust health insurance, because I believe patients will present early if they are insured, if they don't have to pay out of pocket for screening. Thank you.
Dr. Iwuji?
Thank you. And my last words are prevention, always better than cure. And so we know that lifestyle changes, keeping an eye on your weight, not smoking, that can really help reduce the risk of kidney cancer. So please let us all look after our health and well-being. Thank you.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.